So bladder infections, make sure, number one, that it truly is an infection and not something called interstitial cystitis. Interstitial cystitis is when the bladder wall is inflamed, and this is usually an autoimmune disease and not an infection. And I can't tell you, especially with cats, cats get this a lot. Dogs can get it as well, but the amount of bladder infections that are treated with antibiotics that really aren't antibiotics, I can't even tell you how often that happens. A lot. Please make sure that it's not spay incontinence, that again, you don't want to be giving spay incontinence, which is an issue when your dog has a reduction in its estrogen and or sex hormones, and it starts to just lose its bladder control. With cats, be sure that they do not have a urinary blockage. This is a life-threatening situation. So that's a really, really big one that we're going to talk about a little bit in a minute. But please make sure that your cat doesn't have a blockage when you're thinking that it's just an infection. So I would take in a sample. The best way to do this is with a sterilized stainless steel soup ladle. Try saying that fast. Try to catch the urine midstream, and don't touch your animal's body. So the first morning urine sample is absolutely the best one if you can catch it. And what you do is you just sort of follow them. And as soon as they squat, I mean, it doesn't matter if the bottom of the ladle touches the ground. As soon as they squat, try to slowly slide it in underneath, because don't forget, don't have to rush in and get the first little bits of urine that comes out. Slowly slide it underneath, and then try and let some of it come out and hit the ground. And then so you're getting sort of mid catch. For cats, you can always have something on. Oh, once you catch it in the ladle, make sure that you have a sterilized from your dishwasher, a container that you can pour it in. Put it in the fridge right away until you can and try to drop it off at your vet clinic ASAP, or if you're taking your dog in or your cat in for an exam for a bladder infection, then bring it with you. If you're collecting cat urine, it's a little bit more difficult sometimes. It's always a good idea, if you have kitties, to have something called Nosorb on hand. You can just buy it from your vets. Nosorb is a sterile cat litter, and it doesn't absorb anything. So it's not even cat litter. It's just this black stuff that almost looks like charcoal, but it isn't. And the cats can move it and it feels like litter, but when they pee, it doesn't absorb any of it. So you wash their litter out, the litter box, you completely disinfect their litter and then rinse it. So make sure that it's completely clean. You put the Nosorb in, you leave your cat alone, let them pee, and then you take the whole litter box and litter and everything, and you pour it back into the container that it came in. Then you put that back in the fridge, and again, drop it off at your vet's right away, or bring it in when you're taking your cat in for their exam. Big time, be sure to ask for a culture and sensitivity with this, because this is going to show you again that it's true bacteria and not just bacteria from contamination. Your vet will be able to prescribe the correct antibiotics if one is even needed, instead of it being, a contaminant and they think it's a bacteria, but it's really just E. coli from it being dirty. And you can make sure that the right antibiotic is prescribed, which is really important, because in my time of having my vet clinic, the amount of bladder infections that I saw, animals that came into me and for second and third opinions because they had antibiotic resistant urinary tract infections. So even the antibiotics that were out there didn't work on the kind of bacteria that these dogs were getting in their urine. A lot of them were something called Proteus and some terrible stuff. So that won't happen if the correct antibiotics are chosen right from the very beginning. So, homeopathic remedies for bladder infections. If there's a sense of urgency and frequency, so they're asking to go out a lot, or they're even peeing in the house because they can't make it out, or you just let them out and they pee once and then they get up and they walk again and they pee again. That's a very clear sign of a bladder infection. Always, always, always get it checked out, especially if you have an older dog, to be sure that it's not a prostate tumor. Make sure that it's not a, a tumor in their urethra or anything like that. You just want to make sure. And what you want, but you can start with this before you even get to the clinic. Like I said, sometimes if your animal starts off like this and you can't get an appointment till the next day, you don't want to leave them in this kind of pain. So start off with a combination of arnica, aconite, nux vomica, and cantharis. And you give it every half hour, 2 times, then every 2 hours, 2 times, and then every 8 hours for 4 times. You should see a difference in 4 hours. If your animal's getting worse or they're not getting better, then I would probably stop it. If you don't have anything else to go to, keep giving it unless they're getting worse. If they're getting worse, then you need to stop. For young animals or ones that are clingy and seeking attention, that aren't showing the urgency and the frequency, they're just going out a little more often, or maybe they've made some mistakes in the house, they've peed in the house or something like that, but they're young and you can actually see a string of mucus coming from their vulva when they pee, or their penis when they pee. Then what you can do is you use the same remedies, but you replace cantharis with pulsatilla. And then you just do it exactly the same way. You just don't put cantharis in it. You put pulsatilla in it. You can get puppy vaginitis that looks a lot like a bladder infection too. If you think it's puppy vaginitis, or it's showing like that, you can do the same thing with the pulsatilla. So cats. If those homeopathic remedies that I just mentioned haven't helped from the schedule from the other slide, within 2 to 4 hours, you have to take your cat to the vet. It's crucial to rule out a life-threatening blockage. That's a really, really important. Now, when you get to the clinic and they do the exam and they say, yes, your cat is blocked, some veterinarians will recommend using a catheter. And at this point, I would urge you to ask them if it's possible, if they could try pain medicine and a muscle relaxant first, and allow them to give you their personal opinion on your unique situation. So they may say, absolutely no way. This cat's bladder is so massive. If we don't get urine out now, it's going to rupture. And then you know what? You've got to do it 100%. But if they say, yes, your cat's blocked, but the bladder is small, so sure, let's try the pain meds and the muscle relaxants and see if he can pee on his own. Most of the time, blockages happen with male cats, and they come from crystals. So a lot of people don't know that female cats have crystals just as much as male cats, but they don't have the little tiny skinny urethra like the male cats do. So when a cat has crystals, what winds up happening in male cats is, as they're peeing and urinating, it irritates the lining of the urethra, and then the urethra gets inflamed, so it becomes even skinnier. But then what it does is it spasms. So here comes the crystals down the urethra, and then this is the urethra, and then all of a sudden the urethra spasms and nothing can go anywhere. So the crystals get stuck and everything just shuts. If that's the case, by using a catheter, unless I said it's life-threatening, you're trying to push, they anesthetize them, then they're trying to push the catheter in and either push through the crystals. And what happens a lot of times is it scars them. It's because it's so teeny, teeny, eensy weensy that they wind up scarring the urethra. And then your kitty is more prone to getting blockages than before. So that's why I'm saying if you can ask them if you can do the drugs and wait and see, that would be the best possible solution. Um, when an animal does have crystals, a dog or a cat, but like I said, lots of times lots of cats have them, it can be managed extremely well with raw species appropriate diets and things like slippery elm, marshmallow root, homeopathic remedies called berberis and hydrangea to break down the crystals, and nag, which is N-acetylglucosamine. Um, Stephanie put this in, it was so cute. It can be easy peasy. Easy peasy is a protocol that I designed from my practice to give to cats and dogs that have crystals, but also just in general to keep their bladder really, really healthy. Nag is something that is, I can't even say it. It's like it's the most phenomenal nutraceutical on the planet for any kind of chronic inflammatory response around smooth muscle, like interstitial lining, the gut wall, the lung wall. So for cats that have interstitial cystitis, which I bet you tons of them do, nag is phenomenal. So again, if you're concerned and you're not sure how to give all this stuff, and it would be way too long for me to tell you how many milligrams, where to get it, how to source it, how to make sure that it's a clean product and a clean ingredient. I feel kind of weird when, because this is not about selling our products. This is really about me helping you guys. But one of the reasons that I started Adore Beast to begin with was to do exactly that, is to create protocols to support pet parents to not always have to put their animals on drugs.